My name is Dr. Jeff Nicholson. I'm a physical therapist and the director of physical therapy here with Pain Stop Clinics. I'm here to talk to you a little bit today about low back pain. So low back pain, as you probably know, is a very common occurrence. Statistics show it affects up to 85% of the population at some point throughout their life. Fortunately, the majority of those cases go away. However, low back pain has a tendency to become a chronic issue at some point, which is where Pain Stop Clinics comes into play. So low back pain can come from a variety of sources. As you can see, there's multiple structures here in your low back. Pain can be coming from facet joints, which are these joints right here that run along the back side of the spine. It could come from intervertebral discs, which are these gelatinous-like structures that you see here. Start from nerve roots, which exit through the sides of the spine here and go down to innervate structures in our legs and in our trunk as well. Or it could come from the tissues, soft tissues that insert in this region in the spine. So there's ligaments that run along here. There's obviously muscles and fascial tissue that run along here as well that can generate pain with any kind of strain or sprain in that area. Regardless of the cause of low back pain, there are some simple treatments that we can do. To help prevent acute issues from becoming chronic, because the majority of these cases of pain will resolve on their own with conservative treatment. So today I will show you 5 simple exercises and stretches if you happen to have any back pain that pops up on you at some time in the future that hopefully you could use to manage it at the time. And if these aren't effective for treatment, then make sure to come in and see us at Pain Stop so we can get a better diagnosis. And I'm going to have my model Adonis help me with some of these stretches. So I'll go ahead and lay on your back here for me. Perfect. So the hips and the low back work very intricately in what's called the lumbopelvic complex. And basically, hip motion can help reduce low back pain just by getting back to normalized motion. So a lot of times when we have low back pain, we don't want to move, or we feel very stiff, and that makes us want to sit around, when realistically laying around is the worst thing that we could do for low back pain. So this first exercise, I'm going to have Adonis cross his leg over here. Perfect, just like that. Should be comfortable. We don't want to push through pain with any of these exercises or stretches, so if something starts to feel uncomfortable or your pain starts to increase, make sure to terminate the stretch. From this position, I'm going to have Adonis gently rock his legs side to side here, so trying to keep the back on the table, really just moving through the hips here. Nice and slow side to side. Perfect. He should be feeling, in addition to a little bit of motion coming through the hips here, a light stretch coming through the back here in the muscle called the piriformis and the external hip rotators, which can often tighten up and basically help to cause more low back pain. So you feeling a nice comfortable stretch with that? Good. So typically we'll have him do about 10 times back and forth with this one, and then I'll have him go ahead and switch legs. So switching here, boom, perfect. And for a little bit of a more aggressive stretch, he can even put some pressure through this knee here to increase the stretch as he's coming back and forth here. So nice, slow, controlled, gently working the muscles that control that lumbopelvic complex, as well as getting a nice comfortable stretch through the back of the butt. Good. This next exercise is called a bridge. So really with this one, we're working on getting some gluteal activation, your butt muscles here. Really those help to stabilize your hips, to decrease the amount of force that goes into your low back. So really the best way to have a nice healthy low back is to have nice strong hip muscles and buttock muscles here. So really I'm gonna have Adonis pushing down through his heels from this position, trying to lift his butt up off the table right here. Good. Nice and gentle, and trying not to arch through the low back very much here. Nice and slow back down, just real controlled motion. Should feel a nice strong contraction in your butt muscles here, and not too much going on in the low back. Maybe a light stretch coming up. This is another one that should be very comfortable. A lot of times after incidences of low back pain, gluteal activation can be painful, so really just trying to gently work into this can go a long way towards dealing with your pain and getting out of fearful habits. So typically with this one, we like to do about 10 repetitions as well, and we'll do 2 sets with this one, so 20 total, making sure to take a break in between. So keep on going here for me, Adonis. Perfect, and again, he's staying nice and tight through the low back here, and using the butt muscles to execute the motion. You might feel this one a little bit in the back of your legs as well. That's okay. Good. Comfortable? Okay. Perfect. Just give me a couple more there. Good. And you can see he has pretty good form here. He's staying nice and tight in his core, nice and tight in his low back, and really just using pure hip motion to execute the motion here. Exercise I'm gonna go ahead and show is gonna work on lumbar range of motion and really just controlling that range of motion, getting the muscles to work like they're supposed to, and again, getting out of the fearful habits where we don't wanna move because we're scared of pain. So I'm gonna have Adonis go ahead and roll over. He's gonna be on his hands and knees. Perfect, just like this. This is something you could do in your bed, something that's comfortable on your knees and hands. Go ahead and bring your knees up a little bit farther for me. This way, perfect. So this is called the quadruped position. All I'm gonna have Adonis do here is really trying to increase the motion through this area right here, okay? So I want you to go ahead and arch your back down this way. Good, trying to stick your butt out, rolling all the way around. Good, got a nice little crack in there. And then rolling all the way the other direction, okay? So try to tuck your butt under this time, coming up that way, and try to arch your back. So they call this exercise a cat-cow or a cat-camel because you're arching your back like a cat and then you're kind of sinking it in like a cow. So really just trying to work this range of motion through this area, nice and gently back and forth. Perfect. Got good control here. You will feel the muscles turn on here. And again, with this one, when you're working into extreme ranges of motion all the way into this extension motion as you're going down or flexion as you're coming up, you can start to get pain in end ranges of motion. So just go in a comfortable range and you should slowly be able to increase what you could tolerate here. Perfect. Is that feeling okay there, Adonis? Perfect, just give me a couple more there. This one I like to usually have people do about 15 of, really as much as they need to start to feel like things are loosening up in that area and they're comfortable with the motion. Not pushing through pain. Perfect. Very good. And go ahead and take a little break there. This next, I'm gonna have Adonis lay on his back again. These exercises, stretches are in no particular order, so you could do them in any order that's comfortable for you. And if one feels better than others, feel free to do those ones more than the others as well. So this next one is just called a knee to chest stretch. It works on a little bit of gluteal range of motion, gets a nice comfortable stretch through the back of the hip, and then also gets a little bit of flexion going through the lumbar spine. So what I want you to do is go ahead and bring this leg up. Good, and most of you have probably done this stretch before. So go ahead and use both hands, grab onto your knee here. Nice comfortable pressure until you're feeling a stretch through the back of your butt here. Feel that? Perfect, don't push through pain, don't pull too hard. Nice comfortable stretch, not bouncing into the tissue or anything like that, but holding it for about 20 seconds. And then after 20 seconds there, go ahead and relax down and we'll switch legs. Typically do this one about 2 to 3 times per leg. Should feel some temporary relief of stress through the low back and through kind of the back of the hip area. Good, perfect. That feeling comfortable? Okay. Very good. Is a hip flexor stretch. So typically in today's world, we spend a lot of time sitting at our desk for work, sitting on the couch watching TV, and these front muscles right here, called the hip flexor group, have a tendency to become very tight, and they can often contribute to what we're feeling for low back pain. So getting a nice comfortable stretch through this area can help to deal with symptoms as they arise. So what I'm going to have Adonis do is go ahead and go into a lunge position. So bring this leg back for me here. Good. Bring this knee down towards the ground. Perfect. And from this position, I'm going to have him keep nice and tight in the core, tucking his butt in. So feeling it here. Good. And then I want him to just lean forward into the stretch this way. The stretch should be coming from the front of the hip here. So again, you could see Adonis has a tendency to extend through his low back here. That could further cause pain if you're already having pain with that kind of motion. So I want you to be very good about tucking in your core, nice and tight there, and then shifting your hips forward instead of leaning backwards. Good. You feel a comfortable stretch to the front of the hip here. This one can provoke your pain, so be careful with it. Keep the stretch very light. 10 being maximum stretch, 0 being no stretch. Try to keep it around a 5 out of 10. Do this one for about 15 seconds, then take a break, come on back. Good. Can do this one in bed again, or if you have a nice pad that you could put your knees on. Careful about knee pain with this one, obviously. And then go ahead and come into this again. We're gonna do about 2 sets of 15 seconds, then we'll switch sides on this one, okay? Try not to bounce into it, so you see he has a tendency to kind of bounce forward to get the stretch, but it should be nice and smooth in and nice and smooth back out. Perfect. And then we'll go ahead and switch sides after this one. So there's 5 nice, easy, comfortable exercises and stretches that you could use to help deal with back pain as it arises for you. If those don't do it and help you get your pain away, make sure to come see us at Pain Stop Clinic so that we can get a more specific diagnosis and treatment plan laid out for you. So that does it for 5 easy exercises and stretches you could do to help deal with your low back pain as you may have it. If that doesn't do it and that doesn't deal with your pain as well as you might like, make sure to come see us at Pain Stop Clinic so we can get a more accurate diagnosis and treatment plan laid out for you. And make sure to visit us at painstopclinics.com or call us at 480-331-4222. Thank you.